I'm so pleased to be here this morning. We are grateful to Southeast Community College and all the work that they're doing to help all of you who need CEUs. We are also extremely pleased to have this segment and the segment that we put together last night filmed. And we can thank the Community Health Endowment and CIC in the Mayor's Division of the City of Lincoln for being willing to do that. And we're also thankful to the Seniors Foundation. This event, it comes through an endowment that was given by the Lancaster Manor Foundation. When Lancaster Manor was sold, their foundation dissolved. The funds in that foundation were contributed to two organizations, and we're one of them. We put that money into an endowment, and we are using that through the Seniors Foundation for education for professionals in the field. So this is an ongoing event. We'll have one every year, and I am delighted that all of you are here today because you are in for such a treat. Michele Segar is a very impressive woman. She's not very big, but her accomplishments certainly are. Let me tell you more about her. She's a University of Michigan behavioral sustainability researcher and the Associate Director of the Sport, Health, and Activity Research and Policy Center, which is called SHARP. Dr. Segar is a nationally recognized thought leader, pioneering messages and methods to motivate individuals to sustain healthy lifestyles. She's a media expert. She's featured monthly in places like the New York Times and the U.S. News and World Report. Her award-winning research challenges the status quo within the health promotion industry and healthcare by showing that logical rewards like health and weight loss do not motivate most to stick with health behaviors, as well as emotional and immediately experienced rewards, such as daily well-being. Dr. Segar's evidence-based and thought-provoking recommendations are changing the way that healthy living is being promoted worldwide. Her innovative research and practical messages generate accolades from the prestigious organizations such as the Society of Behavioral Medicine and the North American Menopause Society. She has a PhD in psychology, an MPH in health behavior and health education, and a Master of Science in kinesiology. She has all of the data and research background and presents a message that every one of us will understand. Please help me welcome Dr. Michele Segar.
So what I'm going to be sharing with you today, I think those of you in the audience will be able to walk away with new ideas, questions, and methods to use with your clients and patients. So here's something I'm very biased about. Even though there's some research that does not support this idea, I don't believe we should ask busy people to change more than one behavior at a time. And the reason that is because we know from research in decision making that the more decisions we have to make in our day, the more our ability to make good decisions decreases. Our self-control muscle, our ability to think analytically about things actually weakens. And the research has shown that our brains actually use up the glucose that is needed. So by the end of the day, when we have to make a lot of decisions, whether it's about what television to buy or what message to tell your colleagues, all of those decisions add up and actually weaken our willpower muscle. And so I come at this saying, we have our whole lives to learn how to sustain a behavior. How many years is that? 20, 40, 60 years. Why wouldn't we take 1 to 2 years to learn how to integrate a key behavior like physical activity or key behaviors related to healthy eating or the key behavior of making sure you get enough sleep? And so that's my bias. And in this presentation, I am primarily going to focus on physical activity as the behavior we work through. And the reason is because that's where most of my research lies, but also because I'm going to be teaching you new methods and questions, and for consistency's sake, it's helpful if we stay on the same behavior as we progress through the method that I'm going to teach you. But that doesn't mean that you shouldn't be thinking, if it comes into your mind, well, gee, what does this have to do with smoking cessation? Or what does this have to do with eating more fruits and vegetables? And in fact, if those questions arise, raise your hand and let's talk about them. But I wanted to give you the heads up that that's how I was going to go about organizing this. So this might be a little late in the direction, but please don't read ahead. And the reason is because for you, I have developed an educational experience that's based on you only learning certain things in a progression similar to the educational experience that I've developed for my clients. And the way that we're going to begin is I'm going to have you answer questions that I'm later going to ask you to answer, you to have your patients and clients answer. So in your handout, there are, on the opening on the first page, there's 1, 2, 3, 4, 5. And you can stop with Hannah and Sam. So I'm going to give you, these are really crucial questions. I'm going to give you 5 to 10 minutes, depending on how long it's taking you, to answer these questions for yourself. Okay, so we're going to leave that for a minute and we'll revisit it later. I want to tell you about Hannah and Sam. They're twins. They're 49 years old. They're both married, and they both have 2 kids, the same ages. They're very similar. They're both 40 pounds overweight. They're both engineers, and they both go to the same doctor's office, but they see different clinicians. So Hannah and Sam went to their doctor. They went to their different doctors. They go every year for a physical, and every year the doctor talks about, or the nurse practitioner talks about, that they keep putting on weight and that they should do something about it. But this year, both of their clinicians, their office manager, had really decided that they needed to do something to help their patients become healthier because they were getting pressure from insurance companies and organizations. And so they both suggested that Hannah and Sam start to exercise more. And Hannah and Sam were they welcomed the opportunity because they knew they were tired of carrying around that extra weight. But there was a big difference, actually. Hannah's clinician suggested that she use exercise as a way to have more energy in her day. During her office visit, she told her nurse practitioner that she'd been feeling really fatigued and tired and just kind of down. And so the doctor said to her, physical activity can really help with energy levels. So why don't you start moving more and see how you feel? Whereas Sam's doctor said to him, Sam, this is really getting grave and we've got to do something about this. And you need to lose weight. So, please start exercising. And both of them were kind of gung-ho. Both of them felt like, it's time. I'm going to do something. So Hannah started out with her exercise week 1, and she did what she said she was going to do. Week 2, no barriers. She did her planned exercise. Week 3, she did what she said she was going to do. And Sam was so excited to lose weight. He knew this was the time. He was finally going to get it right. So he started out with a vengeance and exercised, lost 3 pounds the first week. The second week, he made all of his exercise goals, lost another 2 pounds. And week 3, again, he's still going strong, but his weight is starting to not go down more. By week 4, Hannah is starting to notice something really different. She has more energy. And not only does she have more energy, she's starting to notice that she's actually enjoying her work more. And she also notices that she doesn't yell at her spouse as much, right? She's starting to notice that she's a more patient parent. So what's happening is that she's starting to make the connection that by moving, she's enhancing her own experience, and that's helping her be better in all of her cherished roles and responsibilities. And because of that, physical activity is starting to feel like a gift that she's giving herself. Week 5, she keeps at it. Week 6, she is going strong. Unfortunately, by week 4, Sam's weight loss had plateaued. And because his reason for exercising was to burn calories and lose weight, he'd been going to the gym and working really hard on the Stairmaster for 60 minutes and sweating all those things that we said the aliens were going to teach us to do to hate exercising. And guess what? They work, because he was really tired of exercising. And in fact, he was tired of it. He didn't like it. He wasn't seeing the results. And exercise was starting to feel like a pretty big chore. Well, by week 5, other things started getting in the way. Got to return those phone calls. Keep up on Facebook. Got to take those kids places. Have to do the taxes, and of course go grocery shopping. And what wound up happening, and notice this is very different than what happened to Hannah. These things did not get in her way. She did not let them get in her way, because she, gosh darn it, she was going to give that gift to herself because it was improving everything she did. And at the end of the day, for Hannah, movement was a gift, and she has not stopped since. But for Sam, it became a chore, and things just took over until his plans just faded away. Do you relate more to, with your patients and clients, are they more like Hannah or more like Sam? Sam? So I want to suggest to you, and what a large part of my method in this presentation is going to be about, is that one of the key issues that determined who succeeded and who failed was the reason or purpose for the behavior of exercise. And I want to also suggest to you that health, which is what we've been taught to promote to especially in healthcare, to our patients, that health is actually turns at self-care behaviors that have the potential to enhance everything we do, that we turn them into chores because we ask people to link them to external goals, stepping on the scale. This is whether you know you're successful. Every week or every month or every year when you get on the scale, you'll know if that thing you were trying to do every week actually works and whether it's a valid activity. External goals and external feedback. In contrast, when you ask people to do self-care behaviors like exercise for things that they experience inside of themselves, like energy and vitality, it turns the behavior into a gift, because what you're doing is you're asking people to notice how they feel internally. Their internal experiences are the feedback for the behavior. And lucky for us, everyone in the field, the same behaviors that actually lead to decreases in weight and improvements in cholesterol and all of that, we would be in a problem we would have a problem if this weren't true. The same behaviors that lead to these changes in biomarkers also lead to energy and vitality and reduce stress. So we've got these different groupings of benefits and rewards for behavior, but our field has taught us to market them to people for these reasons, when in fact, this links a behavior to the immediacy, to how we feel right now, and the experiences, for the most part, are positive, and there's some categories of behaviors that this concept is a little more complicated with, like addictive behaviors, but I still think it works in, and if there's time, we can talk about that. But this, when we promote self-care behaviors for the immediacy, the immediate experiences, then we're giving people a feedback mechanism to know whether they're achieving their goals in the moment, and because it's a positive reinforcement, it keeps reinforcing them doing it compared to something like this. So I've come to believe, and I did not intend to believe this, in fact, I hypothesized that health and disease prevention were great reasons to do self-care behaviors like exercise, but my research showed me otherwise. So I've come to believe that there are a grouping of wrong whys, and I want to show you what I think they are. Abstract medical issues, cholesterol, heart disease, diabetes. Trying to change your behavior so you don't get something in 20 years. Some things that are abstract and clinical. Logical, better health, and weight. Why do you think that these whys, how do these influence behavior? Why am I saying they're the wrong whys?
Not enough motivation. It's always tomorrow.
So it's about tomorrow, and that isn't very good for motivation. Why else? Intangible. Why else? A job, right. So basically, what happens is when you initiate behavior with the wrong whys, and there is no truth. This is a wrong why for everyone, because people are different and have different things. I call these the wrong whys because in general, when we do things that we have to do for tomorrow and that we're supposed to do, what happens is that influences the quality of motivation that develops within us for the behavior. And the wrong whys lead us to feel that a behavior is a chore or a should. But that doesn't stop us from doing the behavior, right? You go to the clinician's office, they tell you to start exercising, you start exercising. You know, the April issue of Women's Health comes out, and there's a new diet on the cover that promises you will lose 10 pounds in 2 weeks. You start. You've got a wedding in a year to go to, or a bar or bat mitzvah. You start. The problem is that these types of whys usually lead people to eventually stop. And the reason is because the whys don't create a compelling, ongoing source of motivation. And people fail and stop. How long do people stop for? It varies. Could be a week, could be 2 months, could be 5 years. And then they start again searching for the next wrong why. This is basically the system in our whole society, but especially in healthcare, that we have given patients and people to follow, and I call this the vicious cycle of failure. So why do you think we're stuck here?
Don't know how to get off.
And why don't we know how to get off?
I don't think it's because we have the right information. This is what we've been sold all of our lives.
Right.
If I tell somebody that you need to lose weight, I'm telling them you need to lose weight because you're going to make the efforts for these other diseases and things. So obviously you need a different plan.
Right. So, remember what I said might challenge your professional education on this topic. This is what we as professionals have been taught to do. And it's understandable because our fields are basically steeped in a medical paradigm. So in medicine, if someone is sick, you try to heal them, and it's based on dosages and prescriptions, and there's a right way to do things and a wrong way. And the problem is that our human psyche and our human nature, in fact, doesn't respond so well and doesn't necessarily do what's in our best interest as we've been set up to target and talk to people about. So let's talk about why and how we've learned to believe these things. So let's think for a moment about what we have learned about why we should be exercising. Right? It's for burning calories. And just so you know, because I see people looking around, in general, you're not going to have these images. You're going to have kind of the primary heading slides and the material that you're going to need to fill out. You know, men's exercise, right? Build a great lower body. Now, I'm not sure what part of the lower body they're talking about there. Fitness is always associated with being thin and, of course, airbrushed, right? That's how they're motivating us to start and try again, giving us an impossible standard. But this is what exercise and fitness means. Of course, we also learn about it in clinicians' offices, as many of you are the clinicians in the office. And research shows that when exercise is brought up in a clinician office, it's usually brought up within the context of dieting and weight loss. And of course, they teach us how to exercise. There is a special place to exercise, and you better not move your body on your way to that place. Because it's the wrong way. It's the wrong way to move. So what I'd like to do now, as your tables, there's going to be some questions up here, and I'm going to walk around for about a few minutes. I would like you to talk about these questions. What have these messages taught us about being physically active that we just looked at? How have they taught us to exercise? What have they taught us about taking care of ourselves? And how do they make us feel about being physically active? So you're going to have about 3 minutes to talk amongst yourselves, and I'm going to walk around and eavesdrop. So what have we just reviewed messages before answering these questions. What have these messages taught us about being physically active? So if you do follow this way and you do it, all the weight will fall away. Is that basically what? And we'll look like those fit bodies. How have these messages taught us to be physically active? Work hard. What else?
It's taught me to forget it because I'm not going to ever look like that.
It teaches you, been there, done that, doesn't work, bye-bye, right? How do these messages make us feel about being physically active? How do we feel about it? Why do it anyway? Yeah, I see. Go ahead. Guilty, a really good word. Guilty, yes. Rebellious, absolutely. And I just want a side note for the one worksite wellness person here. In the field today, and I guess that there may be more pressure coming down the line in clinic offices too, but in organizations, there is a very new, strong push, hard push to get employees to pressure employees to start being healthier, and with the notion that, well, if you force them to do it through financial incentives, that they're going to be successful and the company's going to save money. But the reality is that people start to feel really resentful when they're being told that they have to do something and they have to do it this way and they have to achieve that. And what winds up happening is there's a huge backlash. Again, remember the vicious cycle of failure. People start. The problem is it doesn't get most people to continue. And something that we're not even thinking about, which I think is a really essential a notion, and that is what if we are getting people to exercise regularly, but they're doing it? I can't believe I have to do this. It sucks. Do you think that stress is healthy? No. So, I mean, I wonder, I don't know the science on this, but boy, would I love to do a study where you evaluate the biometrics of someone who exercises because they want to and in the ways they want to, and you measure the same biometrics in someone who's going to do it like this because they're going to have $500 more put on their health insurance premium. I wonder if there's going to be a different I don't know, but I wouldn't be surprised, right? Okay, so I heard some really interesting conversations about this one. What have the messages about how to be fit in physical activity and just the messages taught us about taking care of ourselves? It's a what? A job? What else do these messages teach us about taking care of ourselves?
You feel guilty.
You can't get there. You feel guilty. What else? Selfish. It's our own fault if we don't achieve what everyone else is, right? The reality is that the way we've been promoting, that with the emphasis on weight and biometrics, what we have been doing is we've turned self-care, this very crucial part of our lives, into really it's about weight loss and body shaping. And that if we're going to take care of ourselves, we don't think about immediately, gosh, I don't have a lot of energy. I need to get an hour more of sleep a night. No, we're always focused on your BMI is 35 and you're pre-diabetic and you better do this. And again, we know from 30 years of that approach, it doesn't work. But not only doesn't it work to get us to exercise, I would suggest to you that it actually inhibits us taking care of ourselves in the way that we need to. It distracts us from how to really take good care of ourselves. So I want to suggest to you that our whole society, especially healthcare, has what I call branded or converted self-care behaviors like exercise into body sculpting tools and bitter pills to take. So, just out of curiosity, what do you think that turns the meaning of exercise into? A chore or a gift? So here's what I wanted. This is fun, okay? You know, this is about physical activity. So guess what? I am going to randomly choose 3 tables, and I'm going to ask the people at the table to stand at the number that reflects how their patients feel about exercise and physical activity. What?
The patients, not yourself.
No, patients, not yourself. So I just want to show you where the numbers are. The 1 is over here. The 2, so these are the real chore-based meanings over here. The 3, it's kind of in the middle, not sure, ambivalent. And then the 4 and the 5 gifts are over there. So I think I'll choose tables that let's see. I think I'll choose you and your table and then your table. And what I'd like you to do is get up and stand at the number from your experience where your patients or clients feel about exercise on these, okay? Does that make sense? I just want you to stand under the numbers. Does that make sense?
Do you want us as a group?
No, individually. Individually, I want you to stand where your clients or patients feel about exercise.
I work in long-term care, and actually I could pick 2 numbers because our patients, if they just need to do some exercise, would pick a 1. But if they have physical therapy, then it's something the doctor ordered and it's special, and they would pick a 5.
Oh, so the exercises from the doctor feel like a 5.
If they have a physical therapist come in and work with them individually. But they could do the same activity without the physical therapist, and it'd be a 1.
Well, that's a really interesting dichotomy. So if someone is there helping you do it, supporting you through it, you feel taken care of and directed and supported, and then it's a gift. But if you have to do it all by yourself, same behavior, it feels like a chore. That's a really good contrast. Who else standing here? Why? How do your parents? Yeah.
A lot of the communities around here have farmers, and we're from small towns, and my dad's one of them. And having been through the heart surgery process, I think if you try and talk to people that are not just particular farmers, but small town men that work out, exercise just seems like, I don't understand, that's a foreign concept. How can you go to a gym? And a lot of us are from the country.
So the whole concept of going to a gym doesn't really fit into what's important and meaningful in their lives. Okay. You know, one of the comments at the number 3 was something a client recently said to me, and when she was filling out the first part. These are all kind of the beginning parts of the program that I developed, and she said to me that exercise, I think she said it was a 3 on this scale. And she'd already talked a lot about exercise, and she really said some pretty negative things. So I said to her, now why are you a 3 instead of a 1? Because it sounds to me like you really feel about exercise like it's a 1. And she said, well, I want it to be a 3, but it really is. Okay, now that you made me realize, yes, it's a 1. And I think what that gets at is the difference between the intellect, which is, again, remember, we've all been talking about, we've been intellectually taught things, we believe things should be certain ways, but that's not what leads to sustainable behavior. It's really here. It's our heart and how we feel. So if you kind of know that you think this here and you feel it differently here, you got to start where your heart is, because you won't be getting off to a direction that sets you up for success. Because the core of our motivation is our emotion and our heart. So what I want to show you, and then we're just going to take a 3-minute break. I'm sure it's probably time for a bathroom break after breakfast. We'll take a very short break. But what I want to show you is I actually was very curious to ask people, like, why in general do you exercise? So what we did was the team of researchers and I, we read the literature and we collected 18 different reasons for exercising. And then we asked our participants to choose their 3 most important reasons and their 3 least important reasons. And then we asked them to select their most important reason and their least important reason. And we did something called cluster analysis that basically throws all the data together and comes up and shows us, well, these are the reasons why people exercise. And it could have been 18 reasons. But it wasn't. Out of about 260 people, in general, people answered consistently that they exercise for 5 reasons. And I want to show you what they are. 40% said they exercise for health benefits. Not surprising. 21% said they exercise to lose weight. And 14% said they exercise to maintain their weight and tone. And these were 2 different reasons that came together. And then 12% said they exercise for well-being, and 11% said that they exercise for stress reduction. And if you look at this like a pie chart, you can see that 75% of participants exercised for health or weight-related reasons, which really isn't surprising, because that's how we've been socialized. That's what the pictures we looked at. That's what you all know from your experience in general. This is how we've been promoting exercise. Now, when I have this slide up, people always ask me, well, what's the difference between health and well-being? There's no difference, they're the same thing. And I want to emphasize that I'm differentiating those 2 things based on well-being is about how you feel, and health is for the changes in biomarkers. It's for your weight, it's for your cholesterol, it's for your clinician to say you did a good job. So that's the difference. So we ended on this slide, which shows us the pie chart of, in general, why people start to exercise. And one thing I will share with you that I didn't publish that I was fascinated by were the 3 least important reasons to exercise. And this was a group of women who worked full-time between the ages of 40 and 60. Does anyone want to guess what would be their least important reason to exercise? Guess.
Because it's fun.
No, well, actually, people didn't rate that very strongly, but why they would say they wouldn't, this reason would have nothing to do with their exercising. This is a hard question. Competition was their least important reason out of the list, but their second least important reason for exercising was being social. Well, I was really surprised by that because when you think about it, women are very motivated to be social. Women are very social creatures. But what this finding said to me was that women don't perceive of exercise or physical activity as a way to be social. And of course, all we have to do is to look at all the marketing we've had about why we're supposed to be active, and it's not about being social. It's about getting sculpted and losing weight and changing your cholesterol. So in essence, women haven't even learned, especially women before Title IX happened, who grew up before girls' sports were even a part of school. Now, I will say that companies like Curves, they were able to leverage that connection between being social and exercise, and they created this huge, very successful company because they put those together, and they were really among the first to do that. But that's just kind of an aside. So now what I want to do is focus on the why, the reason why, from a different perspective. And I want to say to you that the why doesn't only matter, but it's the foundation for everything we do behaviorally. And I want to show you some data. So we looked at the pie chart, which showed us why participants exercised. Now I want to show you some data about which reasons are associated with the most or least amount of physical activity. So the first chart I'm going to show you reflects a study we did with women between the ages of 35 and 60. And we asked these women to imagine themselves being physically active and then to write down the very first words or thoughts that popped into their minds, kind of like you did at the beginning of this session. And then we coded what they wrote down. And we only had 2 categories. We just wanted to know, we wanted to code between the people who wrote weight loss, body shaping, calories, how I look. We put all the people who said those types of words into one category we called body shape. And anyone who didn't say those words, we just put those together in another group, and we called them non-body shaping. And what we found, and then we asked them to also report about how much physical activity we did. And what we found was that the people whose words were focused on weight and body shape did about 37% less exercise than those who did it for other reasons. Now, this was a very small qualitative study, and we wanted to get a little more rigorous and detailed. And so that's when we did the pie chart study that I showed you before. But what we also did was we followed those women over a year. So we asked them why they exercised, and then we collected physical activity data, and this is what we found. The women who exercised for health compared to the women who exercised for stress reduction, and they were different people, the health group did 26% less exercise over a year. Those who exercised for weight loss did 27% less exercise than those who exercised to reduce their stress. And those who exercised for health did 32% less exercise than those who exercised to enhance their sense of well-being. And finally, those who exercised for weight loss did 34% less exercise than those who exercised to enhance their sense of well-being. So this, and it was these data originally that I understood that there was something going on with health. Before we did this study, I thought health was a great reason to exercise. And these findings really made me scratch my head until I made me talk to people and think really hard until I finally figured out, wow, health may not be as good of a reason as I'd always thought it would be. So I want to suggest to you that logical goals or reasons for behaviors like exercise do not energize behavior long term, as well as emotion-focused and experiential reasons for behavior. So I want to remind you that the people that 75% of our study participants were in the group that did the least amount of exercise. So this is not such a good population level way of promoting exercise, is to focus on health and weight, as our society's been doing. So now what I want you to do in your group, and you have on your handout, you can write these down too. I want you to write down and talk about, why do you think specifically that health and weight loss are not optimal wise for sustainable behavior? I'm not talking about starting behavior. I'm talking about behavior that never ends. Why do you think health and weight loss are not good reasons for sustainable behavior? So I want you to take just a couple minutes and write these down and talk about them with the people at your table. What was a reason you came up with for weight loss and health-focused wise not being good for sustainability? Yes? There's not enough immediate gratification. Yep, why else? When you think about what we care most about in our daily lives, our most cherished roles and responsibilities, where does weight loss and health fit? So the purpose, when it's related to tied to weight, as we age and our bodies change through having babies and aging, that we may not get the same effects. And then again, that doesn't give us feedback that our efforts are working. And then when we have a baby and whether or not we work, we got a lot more important things to think about than what the scale says. And that gets back to that point back there, that this is we cannot talk about any behavior that you're trying to get your patients and clients to do, that you're focused on because that's your job, without contextualizing that one behavior within the craziness of their lives and making sure that that behavior better fit in some really compelling way, or we're right back to the vicious cycle of failure. So I ask similar questions in different ways because the point of this workshop is for you to internalize these ideas, and that's very helpful for learning. So to just reiterate some of the reasons that people already gave, when we think about why health and weight loss may not be great purposes or whys for a self-care behavior like exercise or even healthy eating, I want to talk about that specifically based on research. So I want to suggest to you that weight loss and body shaping is the purpose for exercise, which of course is one of the primary ways we've learned about it through the healthcare system and marketing by fitness companies, that it's a Pandora's box, right? A Pandora's box is this box that you open up and all these really terrible things come out. And that's what happens. Number one, when you link exercise or physical activity to weight, it turns it into a self-objectifying activity. And what that means is that when you self-objectify, you're thinking about yourself from a third-person perspective. How do you view me and my body, as opposed to how do I view myself? And that's known to be detrimental to mental health. And women are known to self-objectify more than men. And so when you link exercise to body shape, you're going to do a lot of how does my body look when I'm exercising, how does it look after exercising to other people. The focus is on calories and intensity. If your purpose of exercising is to lose weight and change your body, you care about burning calories, and the more intense you exercise, the more calories you burn. And that's just the reality of how it works. But what if you don't like to exercise intensely? How many people here do not like to exercise intensely? I'm one of those people. So I'm not saying there's anything bad with exercising intensely. I have lots of friends who love to go and do the spinning classes. But the reality is that, in fact, research shows that among women, outside the United States, they did population level research, and they found that women who moved at lower level intensity had improved mental health compared to those who moved at higher level intensity. So there may be gender differences in our preferences for how we move, but we've only been taught to do it hard and fast, so we burn calories. And so that's another reason why it's a Pandora's box. Another reason, which a lot of people have said already, it turns this behavior into something we feel very guilty about. And we feel negatively about exercise because it makes us feel guilty and because we feel like failures. When we're exercising for weight loss, we are probably getting insufficient feedback that it's working. And this is really important to understand. This is one of the core points, even though it will be reiterated. But basically, if you are going to continue to strive for a behavioral goal, you have to get feedback continuously that you're achieving the goal, or you drop out. That's kind of just a truism of what's called self-regulation. Remember what happened to Sam. He was excited and going strong until his weight started to plateau, and then the reality of how much he hated exercise hit him in the face, and he dropped out. So does exercise really do a great job at producing weight loss? No. And people think, we've been taught to think that dietary changes and exercise are equally important in producing weight loss. But in fact, dietary habits trump physical activity in producing weight loss. And that's because it takes so much to burn one 600-calorie food, and it takes about 2 seconds to eat it. So, right. We feel ambivalent about exercise if its purpose aims to create something that we're really not being very successful achieving. And this gets back, this is again, key point. If your purpose for self-care is to lose weight, how important is that self-care behavior with everything else you've got going on in your life? In theory, when you start, when your motivation is strong, you fit it in for those couple of weeks. But what's most important in daily life? I would suggest our weight doesn't cut it for the most part compared to our families and our work and our friends. So the other thing I want to suggest is that health as the purpose for behavior change is a Trojan horse. It sneaks in, it looks really good, but in fact it's hiding all these negative things that are undermining us. It's abstract. What does health mean? What does being healthier mean? It feels like a chore. Again, this produces insufficient feedback. If you're stepping on a scale once a week or you're going to the doctor once a year, that is not giving you great feedback that your exercise or your dietary changes are helping you be successful. And I want to suggest to you, and it might be because of the type of healthcare system we have in the United States, but I want to suggest to you, we've been all taught to think that health is this ultimate value, right? But I don't actually think it is. I think health is a vehicle for having energy and having the vitality to do what we care most about, and that health is irrelevant until we lose it, and we don't have the energy and vitality to kind of live the life we were hoping to live. And so from a marketing perspective, we should never be marketing the mediary of what people actually want. That's a waste of money. We should be focusing on what people really want and what they need to live meaningful lives. And if you think about how pharmaceutical companies advertise, that's what they do. They don't focus on the biometrical changes that their drug is going to induce in your physiology. They talk about how you're going to be able to laugh with your love and play with your grandchildren and focus at work. They're doing what we need to be doing in clinical practice. We've already talked about this, that health doesn't compete well with other daily tasks and goals. And this is another key one. Logic doesn't motivate. Emotions do. It's not our head that, again, our head gets us to start things, but on a daily basis, our behavior is determined much more and unconsciously through associations we feel, experiences we feel, and emotions we feel. And that's been one of the mistakes of how we've been taught to promote health. So now we're actually going to jump into the brain and behavior. And I am no neuroscientist, and don't worry, this is not going to be too detailed. I want to give you the basics about how our brain functions and how it relates to behavior. Many of you have probably learned theories like stages of change and social cognitive theory and other theories like that. But I would say in the last 10 to 20 years, there's been a lot of research outside of health that suggests that the assumptions underlying those theories that are used in how we approach, how we counsel patients, are based on assumptions that humans make decisions, they make decisions consciously and out of rational choice. And it's not true. We know now through behavioral economics that people do not do what's in their best interest, and they do not make rational choices. And so there's a whole new group of thinking that thinks about brain, the way the brain works and behavior. They're called dual process models of either information processing or behavior. And what they show is that we basically have one side of our brain which functions in logical ways, uses analytical thinking, and another part of our brain that functions through associations really quickly and through emotion. And that they function, they're two systems, and they're often in conflict, but they also function independently. And I want to talk a little more detail about each system. The logic system is analytical compared to intuitive in the emotion system. It's verbal compared to nonverbal. It's explicit compared to implicit or unconscious. It's called reflective. It's slow compared to impulsive and fast. The logic-based system takes effort, and it takes self-control, compared to the emotion-based system, which is actually effortless because it occurs automatically outside of our conscious awareness. And importantly, this system is vulnerable to fatigue, whereas this system motivates unconsciously without even people being aware of it. Our system, it's called the bis-bas system, where either our brains in general want to approach things or avoid things. Now there is ambivalent in there, hanging out there, but in general that's what we're primed to do. And if you think about how we've been promoting health and weight loss to people to take care of themselves, does that lead people to have an approach or more of a avoidant kind of feeling towards it? And that was just to give you an experiential notion about how strong and influential our feelings are. They really do motivate where we go. So I want to go back really fast to this picture. And for those of you, and I'm not really a Trekkie, but in general I want to suggest to you that we've been promoting exercise and healthy eating and self-care and smoking cessation as if people were Spock, right? In logical ways, because Spock always does what's logical, right? There's no emotion in the decision. There's no stress. He does what's the right thing. You can count on him to do it. That's not how we behave. We're more like Kirk, right? And of course, some people would say that Bones would be a better contrast, who's all very emotional. But the point is that humans are not Spock, and yet our whole health promotion system, our healthcare system is set up and treats humans as if we are Spock, and that's a problem. So to kind of close this section, I want to also suggest to you the idea that we do need some parts. We are part logical, we are part analytical, and we do need to plan things. And that the part of health promotion that really sits really appropriately in that part of the brain we could think of as being self-regulation, which is how people manage themselves. It's how people plan and prioritize for the future. And so if we think about self-regulation, which is a very clinical term that I'm sure many of you know, but some of you might not know, it's about how you manage yourself. It means control, and it takes willpower and effort, and it's based in logic, and it's future-oriented. And I call this the how you prioritize into your daily life. How do you prioritize a behavior into your daily life? But on the flip side, on the motivation side, that's about drive and desire and fuel. It's about energy. It energizes. And this is effortless and automatic, and this is based both in emotion and the now. And I call this the why of behavior, because why we do it generates positive emotion approach towards something, or it generates a negative avoidance of it. So when we think about what the word emotion means, it actually is about motion. I want that experience over there. I am going to approach it. But boy, if I don't want that experience or that behavior, I'm going to avoid it. And so emotion generates motion, motivation, and it is very influential. So when you start, I almost think it's more helpful to think about motivation as emotion, because that's more easy to identify. Motivation is a bit of a clinical term, and this is actually how it works. So when we think about this, emotion energizes, so we should target the why. And so let's go ahead and put this in a different direction. Our whole conversation about promoting health should not be about how to help people manage it. That's what we've been taught to do. Get people to exercise, have them set goals, help them figure out how to fit into their lives. That's the wrong order. You're creating the foundation of the behavior in the logic-based system, when the foundation of the behavior is the whole purpose for doing the behavior. The only reason we change our behavior is to achieve goals. So those goals are the actual drivers of the whole process, and they're the foundation, so we need to have that as our starting point. And so this is what I call my behavioral blueprints. And this is what, after many, many years of research and working with people, in this very simplistic way, this is how I think about facilitating behavior that can be sustained over time. Why people do it creates high quality or low quality motivation, or gift-based and chore-based motivation, and that determines how and whether they prioritize it in their daily life and whether they do it. And that's my model, and everything I do focuses on really these two core things, and this is a third thing. And this is how it actually works, that research shows. So the study with the women that I showed you about which women did more exercise and which women did less, certain reasons for exercising, the well-being and the stress reduction, they rated as feeling more gift-like than the health and weight loss reasons. So in a theory called self-determination theory, those reasons would be called self-determined as opposed to controlling. And what we found was that those types of reasons led to more physical activity. But this is how it worked. Those reasons, what they did was they motivated people regarding how they prioritized it and planned it in their daily life, and they did it. And so this relationship between kind of gift-based reasons for behavior works because it gets people to prioritize it. When you feel that the reason is a gift and the experiences you get from the behavior are a gift, then you are motivated to plan and prioritize it in your daily life, and that's how it works. It's very simple. So I want to hit this over the head because this is the core issue. How we feel about the purpose or why for our behavior is an unconscious motivator, and there is research to back this up. it either motivates us in a positive direction or in an avoidant direction. It is the foundation of how we feel about the behavior we're trying to change. And our reason for initiating behavior determines the quality of motivation of that behavior. So these are the key issues around the why. And I want to show you this in a different way. So why you initiate the behavior is the foundation. It's the base, and that determines how and whether people prioritize it and whether they do it. And what I do want to say, which people are already bringing up in conversation, but there's no time in this training to talk about it, that would be a second training, is that priorities in the how is about one word: permission. You have to give yourself permission to prioritize your own self-care. And that's a very important issue related to sustainability, but it's a separate issue, and it necessitates a different set of activities. But it's important that you know that. And we are focusing in this training today just on how to convert the base of behavior, the why, from a chore into a gift. Okay? So how are you feeling? Do you feel like you want a little break, or do you feel like you want to keep going?